You know how sometimes you just need the key info on a topic without wading through everything?
Absolutely. Cut right to the chase.
That's exactly our plan today. We're doing a deep dive into hepatic encephalopathy, or HE, in dogs and cats. It's something that definitely comes up when pets have liver
It
problems.
really does. And HE, well, it covers a whole spectrum of neurological signs, behavioral changes linked to the liver not working right or, blood bypassing it somehow.
Okay.
The good news, though, is that it's often potentially reversible if you can tackle that underlying liver issue.
That's encouraging. So our mission here is pretty clear. Pull out the essential facts about HE, what causes it, what signs to look for, and how vets approach managing it, all without getting too lost in the technical jargon.
Exactly. Let's kick things off with the basics. So HE isn't one specific disease, but more a syndrome, really. It usually pops up in one of three main scenarios.
Okay, what are those?
First, you've got acute liver failure. The liver just suddenly stops doing its job effectively. Second, portosystemic vascular anomalies, PSEAs. Think of those as abnormal blood vessels the animal's born with.
It's like a plumbing problem from the start.
Kind of, yeah.
Yeah.
They let blood skip the liver's filter. And third is chronic liver disease, like fibrosis or cirrhosis. This can cause high blood pressure in the portal vein, leading to acquired portosystemic shunts, or APSS. So new bypasses form later on.
Right, so whether they're born with them or develop them, these shunts mean blood isn't getting cleaned by the liver properly. But what's actually causing the brain issues, the neurological signs?
Ah, that's the complex part. It's definitely multifactorial, lots of things contributing. But the big one, the most studied toxin, is ammonia.
Ammonia, okay.
Normally, the liver pulls ammonia out of the blood super efficiently. But if the liver's failing, or if blood is taking those shunt detours, ammonia levels climb.
And how does that extra ammonia mess with the brain?
Well, ammonia and another substance called glutamate act like neurotoxins. They particularly hit these brain cells called astrocytes.
Astrocytes, what do they normally do?
They're crucial for detoxifying ammonia in the brain, turning it into glutamine. But when there's just too much ammonia hyperammonemia, it swamps the astrocytes. They start to swell up.
Wow.
And what's really interesting or problematic is this swelling also triggers oxidative stress. So it damages the brain cells further. The cells trying to fix the ammonia problem actually get harmed in the process.
That seems like a vicious cycle.
Yeah.
Are there other factors messing with the brain too?
Oh, definitely. It's a whole cascade. The brain can struggle to get enough energy. That's neuroglycopenia.
Right.
The brain's pH balance gets thrown off. Calcium flow gets disrupted. Neurotransmitter systems like glutamate and GABA get unbalanced. Amino acid metabolism changes. You even see an increase in substances that act like benzodiazepines, sedatives.
Really, like the brain is sedating itself.
Sort of, yeah. Plus, you add inflammation and a leaky blood-brain barrier into the mix. It's quite a storm. But crucially, remember, a lot of these problematic substances, especially ammonia, originate from the gut.
The gut-brain axis connection again. So with all that going on inside, what are the things an owner might actually see at home? What are the signs?
The main things are neurological abnormalities. It can be subtle at first. Maybe the pet seems a bit dull, less aware.
Just not quite themselves?
Exactly. Or it can progress to obvious lethargy, disorientation, like they seem lost or confused, maybe agitation. And in severe cases, seizures or even slipping into a coma.
That sounds scary.
It can be. And it's worth noting, like you said, cats with those congenital shunts, the PSVAs, they seem more prone to showing aggression and having seizures compared to dogs.
That's a useful distinction. Are there other signs besides the neurological ones?
Yep, GI signs are pretty common too. Vomiting, diarrhea, not wanting to eat, anorexia. And sometimes you see urinary issues, specifically the formation of ammonium biuret bladder stones. Those crystals can form because of the high ammonia levels being excreted.
And do these signs just stay constant or do they fluctuate?
They often fluctuate. They can be episodic. Owners might notice things get worse after eating, especially a high-protein meal.
Ah, the protein link.
Right. And sometimes, looking back, owners realize their pet was maybe always a bit slow to train, that sort of thing. Learning difficulties can be part of the history.
Interesting.
As it gets worse, you might see that lethargy deepen into, profound sleepiness, unresponsiveness, anorexia, vomiting are common. And in cats, you mentioned aggression and seizures, but also excessive drooling tyelism that can be really pronounced.
Tyelism, right. Drooling.
Also increased thirst and urination, polyuria, and polydipsia, or PUPD.
Okay. And what about specific behaviors that point to disorientation?
Yeah, things like aimless wandering, just pacing back and forth compulsively,
Hmm.
head pressing, pushing their head against a wall or furniture.
Why do they do that?
It's thought to be related to the increased pressure or discomfort in their head from the neurological changes. And sometimes they can seem blind even though their eyes are fine. That's amaurotic blindness. If seizures happen, there might be a sort of warning phase, a prodrome, with subtle behavior changes first.
You've mentioned some cat versus dog differences. Can we just recap those key distinctions?
Sure. So for cats with HE, think more. Patiolism, that drooling. Seizures, maybe sudden aggression, disorientation, and a kind of wobbly, uncoordinated stupor, ataxic stupor.
Got it. And dogs?
Dogs tend to show more compulsive behaviors, head pressing, circling, wandering aimlessly, maybe excessive vocalizing, vomiting, diarrhea, the PUPD, and signs linked to those ammonium biurate stones are also reported more often in dogs.
Okay, that's helpful. Now, what about when the vet examines the animal? What might they find?
Well, especially in young animals with those congenital PSVAs, you often see stunted growth. They just don't grow as well. And their liver might feel small on palpation microapatia.
Small liver. Makes sense if it's being bypassed.
Exactly. And here's a curious thing. In cats with PSVAs, if they don't have blue eyes, aren't Persians, and don't naturally have green eyes, they might develop this distinctive golden or coppery color to their iris.
Really? That's specific.
It is. And in male dogs with PSVAs, there's a higher chance of cryptorchidism, one or both testicles not descending properly.
Okay.
And if the HE is due to acquired liver disease, especially in dogs, seeing fluid build up in the abdominocytes is pretty common.
Right. So we have a good sense of what HE is and the signs.
Hmm.
Let's circle back to the why. What are the root causes of the liver problems leading to HE?
Okay, so those PSVAs, the congenital shunts, they're malformations the animal is born with. Simple as that, structurally.
Just bad luck in development.
Pretty much. The acquired ones, APSS, they develop later because of high pressure in the portal vein system. That's portal hypertension.
Yeah.
And that pressure builds up usually because of some underlying chronic liver disease, like cirrhosis or significant fibrosis.
So the liver gets damaged, scarred, pressure builds up, and the body makes bypasses.
You got it. And the third scenario, acute liver failure, that can be triggered by things like certain drugs, toxins, or maybe severe infections that just overwhelm the liver very quickly.
Okay. And are there things that can make HE worse or even trigger an episode if an animal already has liver issues? Risk factors?
Yes, definitely. Several things can push them over the edge. Metabolic changes like alkalosis, blood becoming too alkaline or low potassium, hypokalemia, low blood sugar, hypoglycemia is another big one.
Right.
Certain drugs are risky. Anesthetics and sedatives need real caution. Specific meds like methionine, tetracycline, even some antihistamines can be problematic.
Things owners might even give at home sometimes.
Potentially, yes.
Yeah.
But probably the most common trigger for an acute crisis is bleeding into the gut, enteric bleeding.
Why is that such a problem?
Because the blood itself contains protein and other substances that, when broken down by gut bacteria, produce a lot of ammonia.
Ah, okay. That makes sense.
Even blood transfusions can be tricky. Stored blood has ammonia, you can have reactions, or just the breakdown of the transfused cells releases compounds. Infections anywhere in the body, constipation because it keeps toxins in the gut longer, and catabolism, muscle breakdown from not eating enough, all release ammonia and worsen things.
Wow, it's a long list of potential triggers to manage. So when a vet suspects HE, how do they confirm it? What's the diagnostic process?
Well, first you need to rule out other things that cause similar neurological signs. Lead poisoning, maybe UTI, certain parasites, primary brain disorders, got to consider those.
Makes sense. Standard differential diagnosis.
Exactly. Then blood tests become really important.
What do you look for in blood work?
On the complete blood count, the CBC, animals with shunts might have small red blood cells microcytosis, maybe a mild anemia that's non-regenerative, meaning the body isn't making new red cells well. Cats might show oddly shaped red cells, poikilocytosis, and dogs might have target cells. Jaundice or high bilirubin might show up with acquired liver disease, the APSS cases.
Okay. And the chemistry panel.
That often shows low BUN and creatinine. Partly due to increased urination, but also because the failing liver isn't making BUN properly. Blood sugar can be low, especially in young small breeds with PSVAs or severe liver failure. Cholesterol is often low too.
What about liver enzymes? Are they always high?
Not necessarily sky high, it's variable. But one enzyme, alkaline phosphatase or ALP, is often quite elevated in young animals with PSVAs. Bilirubin, as I said, usually normal in PSVA, but can be high in APSS. And albumin, a key protein made by the liver, tends to be lower with acquired disease, APSS, than with congenital shunts.
Got it. And you mentioned urinary issues. What does a urinalysis show?
Very often the urine is quite dilute, low specific gravity,
Hmm.
and you frequently find those ammonium urate crystals. Sometimes they cause inflammation or even set the stage for a bacterial infection there.
Are there more specific lab tests for HE?
Yes. Measuring blood ammonia levels directly can be helpful, but it's a bit tricky. Levels can fluctuate, and the test needs careful handling.
So, not always reliable.
Not perfectly consistent, no. An ammonia tolerance test, where you give a controlled dose of ammonia and measure the response, is probably the most reliable functional test. But you have to do it carefully, as it can trigger HE signs.
Right, makes sense.
A test for total serum bile acids, TSBA, is very useful. Elevated bile acids strongly suggest liver insufficiency or shunting. Coagulation tests checking clotting times are important too, especially with acquired disease, as they reflect how badly liver function is impaired.
Mm.
And interestingly, low zinc levels in the liver have also been linked to HE.
Zinc. Why zinc?
Zinc is needed for some enzymes in the urea cycle, which is the liver's main way of detoxifying ammonia.
Okay. What about imaging? X-rays, ultrasound?
They're definitely used. They can help assess liver size, look for those bladder stones, sometimes visualize large shunt vessels, especially with ultrasound and Doppler.
Can you get a definitive diagnosis with imaging?
Sometimes you can strongly suspect it, but for a truly definitive diagnosis, especially to understand the underlying liver disease in acquired cases, a liver biopsy is often the gold standard. A needle aspirate can give some cell information, but a biopsy gives you tissue architecture.
And what might you see in the biopsy, or even brain tissue?
In the liver, you'd see changes matching the underlying cause, congenital vessel issues, signs of cirrhosis, etc. In the brain, sometimes specific changes are seen, like polymicrocavitation or those Alzheimer type 2 astrocyte changes, but honestly, these aren't consistently found, particularly in dogs.
Okay, so diagnosis involves clinical signs, blood work, maybe imaging, and sometimes biopsy. Let's move to treatment. What's the approach once HE is diagnosed?
Well, the ideal treatment targets the underlying cause. So for those congenital shunts, PSVAs, surgery to close or narrow the abnormal vessel is really the preferred option, if possible.
Right, fix the plumbing.
Exactly. But regardless of the cause, or if surgery isn't an option, medical management and supportive care are absolutely vital. That means removing trigger factors and improving how well the animal tolerates protein in their diet.
Diet seems key. What are the dietary guidelines for HE?
Super important. First, enough calories are crucial to stop the body breaking down muscle for energy, because muscle breakdown releases ammonia.
Ah, okay. Prevent catabolism.
Precisely. Then, protein needs to be restricted, but the protein you do feed must be high quality and easily digestible. For dogs, dairy or soy-based proteins are often recommended because they seem to generate less ammonia. You're aiming for maybe 2 to 2.5 grams per kilo of body weight, but you adjust based on how the dog tolerates it.
And for cats, they're carnivores.
Right. Cats need meat-based protein, usually around 3 to 3.5 grams per kilo, again, tailored to the individual cat. Vitamin supplements are often needed. Same, S-adenosylmethionine is commonly used to support liver function. And ensuring adequate thiamine is important to prevent neurological issues, though use injectable thiamine cautiously due to rare allergy risks.
What if they won't eat?
If they're really inappetent, you might need feeding tubes or even partial or total parenteral nutrition, IV nutrition, to get those essential nutrients in.
You mentioned medications helping with protein tolerance. How did they work?
The main goal is to reduce ammonia production and absorption from the gut. Antibiotics, like metronidazole or amoxicillin, can change the gut bacteria population, reducing ammonia producers. Neomycin is another option, but needs monitoring for kidney and ear toxicity.
Any others?
Rifaximin is used a lot in humans, but we have less data in pets. The most common medication is probably lactulose.
Lactulose. How does that work?
It's a non-absorbable sugar. Gut bacteria ferment it, which makes the colon more acidic. This acidity traps ammonia as ammonium ions, which are less easily absorbed and get excreted. It also acts as a laxative, flushing things out faster. You can give it orally or as an enema.
What about probiotics?
Sometimes used, the idea being to promote good gut bacteria. But the evidence for their effectiveness, specifically in HE, is still a bit debated, kind of controversial.
And enemas. You mentioned lactulose enemas.
Yes, enemas can be very helpful, especially in a crisis. Cleansing enemas just help clear out the colon.
Mm-hmm.
Retention enemas, using diluted lactulose or sometimes dilute povidone iodine solutions, help trap and remove ammonia directly from the colon.
And zinc supplementation.
Yes, because zinc is involved in those urea cycle enzymes we talked about. Supplementing can sometimes help improve ammonia detoxification. You'd monitor blood zinc levels.
What if there's brain swelling, cerebral edema?
That's an emergency. Management includes elevating the head, maybe giving mannitol to draw fluid out of the brain, oxygen therapy, and sometimes N-acetylcysteine, which is an antioxidant. We generally avoid steroids, like glucocorticoids, because they can increase risks like GI bleeding.
Are there any, like, last resort therapies?
There are some experimental or salvage therapies sometimes considered, like L-ornithine L-aspartate or L-carnitine, which might help with ammonia metabolism, but they aren't standard practice.
And for seizures?
Levetiracetam, brand name Keppra, is usually the go-to anticonvulsant.
Mm.
It's preferred because it's mostly cleared by the kidneys, not the liver, so it's safer in these patients.
That makes sense. And you obviously need to be careful with other drugs.
Absolutely critical. Avoid drugs primarily metabolized by the liver. And many others, anesthetics, sedatives, diuretics, need very careful dose adjustments because liver disease messes with how the body processes drugs, the pharmacokinetics. Drug interactions are also a big concern.
So careful management is key. Once treatment starts, what about follow-up and preventing future episodes?
Ongoing monitoring is essential. Owners need to watch closely at home for any changes in behavior, appetite, body condition. Regular vet checkups with blood tests are needed to track things like albumin, glucose, electrolytes, especially potassium.
And prevention.
It's mostly about avoiding those triggers we listed. Keep them well hydrated, manage any kidney issues, azotemia, prevent constipation, avoid GI bleeding triggers, treat parasites, be cautious with transfusions, avoid unnecessary protein challenges, treat UTIs promptly, watch electrolytes like potassium and magnesium, and avoid conditions that cause alkalosis.
Can there be permanent brain damage?
It's rare, but yes, in very severe or prolonged cases, some permanent neurological deficits could remain.
And the overall outlook?
It really depends on the underlying cause. If it's a congenital shunt that can be successfully corrected with surgery, the prognosis can be quite good. For acquired liver disease, it depends on how manageable that disease is. Outcomes range from full or partial recovery to progressive disease, and unfortunately sometimes death if it can't be controlled.
Okay, so wrapping things up, hepatic encephalopathy. It's this really complex neurological condition tied to the liver not doing its job or blood bypassing it. Ammonia buildup is a huge factor.
A central player, yes.
And recognizing those often fluctuating signs, understanding the different causes and triggers, and using that combination of diet, medication, and supportive care, that's really the path forward for helping these animals.
Absolutely. And it really drives home that connection between the gut and the brain, doesn't it? The gut-brain axis. When you think about HE, it makes you wonder, what other subtle things might be playing a role? Maybe shifts in the gut microbiome we don't fully understand yet, or low-level inflammation elsewhere impacting things.
That's a really interesting thought to leave people with, just how interconnected everything is inside the body.
It really is fascinating and complex.
Well, thank you for breaking all that down so clearly. Hopefully this deep dive has given everyone listening a much better handle on hepatic encephalopathy and what it means for our pets.